I saw this Instagram post come across my desk a few days ago. What's going on here? What's happening in this picture? Well, we've got a bunch of babies running a code. And on the surface, this is pretty funny. In fact, it's hilarious, but it's also demeaning. Clearly I had a lot of mixed emotions about this. Maybe too many emotions. Maybe I thought about it too much. Well, maybe that's what humor is meant to do. But it brings up a question that the headline of that Instagram post points to. The July phenomenon. The July phenomenon. So for the uninitiated, the July phenomenon is a situation where the influx of new medical residents, or interns as they're known, purportedly leads to worse patient outcomes. Now, some would say it leads to worse patient outcomes, but I'm going to say purportedly, because this is what we're going to get into. And as it's July when I'm recording this, I have seen messages all over social media attacking this, coming at it from all sides. Hey, this is a thing. No, this is not a thing. Oh yeah? F you. Well, F you. You know what? There's no evidence that this exists. No evidence at all. Oh yeah, I got evidence. I see all these new interns. They don't know what they're doing. Oh, ooh la la. And this message came up right after, do not go to the ER July 1 unless you want a brand new intern who has worked their whole life and missed their 20s to conscientiously care for you and will constantly check themselves to consider every other diagnosis in the world because this is their life's ambition. Yeah. All right. There is clearly a lot of emotion around this issue, but the question still remains, is the July phenomenon a real thing? It cannot be answered by emotion alone, and it cannot be answered by anecdote alone, which is, I think, how it happens a lot. It's kind of anecdote and just sort of accepted wisdom. But it turns out that many studies have looked at this question and with mixed results. So let's go to the data, my friends. First off, what is the evidence saying that the July phenomenon is not real, not a thing, that patients do just fine when the new interns come to work? All right, here we go. First off, Annals of Surgery, 2023, just happened. Reassessing the July effect, 30 years of evidence shows no difference in outcomes. All right, so this study says not a thing. In the detail of it, this is a systematic review and meta-analysis. They were getting it from all sides. Went through 30 years of research and found no significant increase in mortality, major morbidity, or readmission rates from the big hitters, the things you really care about: myocardial infarction, stroke, hip fracture, and CABG, coronary artery bypass graft, associated with the beginning of the academic year. So mortality, morbidity, major morbidity, readmission rates, no difference for those major issues. All right, let's get to another study. Journal of General Internal Medicine. The article is titled, "Is There a July Phenomenon? The Effect of July Admission on Intensive Care Mortality and Length of Stay in Teaching Hospitals." All right, what did they find? This was a retrospective cohort analysis of over 150,000 patients. 150,000 patients admitted to the intensive care unit over a 6-year period. And the authors found, here it comes, no significant differences in mortality or length of stay when comparing July to other months. All right, so we've got 2 articles in favor of the July phenomenon being a myth, being a unicorn. Well, not a unicorn, at least being a myth, maybe like a, I don't know, like a dragon. What's a mythical animal? But it's one of those. But wait, there's more. In 2016, a JAMA surgery study found that emergency general surgery outcomes, so these are things non-scheduled surgeries, were not worse and may have been, here it comes, wait for it. Are you waiting for it? You sitting down? You're probably sitting down. May have been slightly better in July. better in July. Now, there's the July phenomenon that patients do better. What is the world coming to? So I'm reading through this literature, and I was an intern in July, and I found it hard to believe that the July phenomenon could be 100% mythical. Working with hundreds of interns on their first day, or first month, come on. To wit. I did a lot of dangerous stuff as an intern. Most of it was errors of omission rather than commission, but there were admittedly a few commissions. Admittedly. So surely there's evidence of at least a shred, just a tiny wafer mint of the truth to the July phenomenon. There must be, there has to be. And here it is. And the evidence, just going to give a little preview, a little teaser here. The evidence points toward specific issues in July rather than, hey, there's this overall trend that more people die. Let's talk first about medication errors. A study of 62 million U.S. death certificates from 1979 to 2006, so death certificate study, take what you will from that, found a 10% July spike, increased spike in fatal medication errors within medical institutions in countries with teaching hospitals. So that was the thing. Is you got, all right, countries with teaching hospitals, countries without teaching hospitals. So in countries with teaching hospitals, you get this 10% spike in fatal medication errors. In contrast, there was no July spike in countries without teaching hospitals. And then here's a real crux of the matter. The greater the concentration of teaching hospitals, the greater the July spike. So there's some evidence saying, all right, well, medication errors, July phenomenon might be a thing. And these findings in the study only held for medication errors, not for other causes of death. Now let's look at joint surgery. So we got medication errors. That's something super common. It's going to be happening in every hospital. Let's get to joint surgery, much more specific. This is from Orthopedics, the journal Orthopedics 2020. Joint arthroplasty readmission rates were found to increase in July. All right. So patients getting that joint surgery, more of them have to come back for admission in July. That was 3.9% in July versus 3.6% in the other months. Wait, what? So from a relative standpoint, maybe there's some significance there. In fact, the p-value was less than 0.0001. So statistically significant. Doesn't seem like a huge difference. I mean, it's like that's an impressive p-value. It's like it's smiling like it just took its first poop in the potty. I don't know if p-values get potty trained, but that's what it reminds me of. The absolute difference between those readmission rates, not that impressive, but there is something. So statistically, yes. Arthroplasty, readmission rates, check. And also, this is what I found the most interesting. Joint surgery, July phenomenon effect was most dramatic at non-teaching hospitals. What? So we're looking at July. It's like, the joint surgery readmission rates, they go up. P-value, make of it what you will. But it was most dramatic at non-teaching hospitals. The heck? Could the July phenomenon be attributed more to new attendings than to new residents? I have not seen a study that looks at that, but that, to me, that data says, well, maybe there's some signal there that the July phenomenon could be something different than we thought. Or maybe it's a combination of all this stuff. But let's just conjecture. Let's look at the overall evidence. There are isolated increases in specific errors like medication errors and readmission rates for joint arthroplasty. Whether that's from an error or not, who knows? So there's a hint of signal of truth to the July phenomenon. However, even though the broader data does not support a generalized effect. What is the bottom line here? Is the July effect, the July phenomenon, or as they call it in the UK, the killing season. At least that's what I read. I don't live in the UK, but that's what I mean. Come on, really? The killing season? Is this a real thing or is it a myth? The current consensus in the medical literature, of which we've covered just a bit here, not even the whole pantheon of studies, indicates that the July effect is not a significant factor in patient outcomes. Now, we've got a few, sprinkles of data showing like a small signal, but a giant wave of studies showing no signal. Do interns know less than more seasoned residents? Of course. Do interns know less than their attendings? Of course. Are interns more heavily supervised by said residents and attendings in July? Most certainly, yes. That's the whole idea. It's not like an intern's inexperience in July is some great mystery in a hospital. Everyone knows it. The intern knows it. The residents, the attendings, the nurses, housekeeping, security, dining services, they all know it. The July phenomenon, the July effect, the killing season, whatever you want to call it, myth busted.